Hey, Lake Charles, Russ Silvers here, your CBS on the Lake guy. Welcome to this edition of Doctor on Demand. And a doctor is exactly what we have. This is Emily Pierce. She's with MAXX Physical Therapy. And what is your doctorate in?
So I have a doctorate of physical therapy.
So that works out nicely then, doesn't it?
Yeah.
Now, they always talk about balance in your life. Everything should be balanced. We're literally going to talk about balance, not just the making sure you have equal amounts of everything in your life, but literally balancing like a juggling act. That is a problem that most people, it happens more frequently than people are aware of, isn't it?
Yeah, and it's very common amongst older individuals.
Now, what can cause balance issues? I mean, we all know the ear can cause those, but there's more than that, isn't there?
Right, and it really depends. You know, it could be coming from the brain, the central nervous system. It could be coming from an inner ear issue, or, just decreased strength, mobility, or a neurological condition.
So that would sound like either ear or neurological, or even, I guess, can we say mechanical, like muscles, bones, things like that?
Correct.
Okay. So what are some of the ways that you treat balance? First of all, is it difficult to diagnose what's causing it?
You know, it depends. It depends on their subjective report, what they're telling me, how I would go about the exam. You can distinguish between vertigo versus, a mechanical problem pretty easily.
Okay, so how would you? Okay, so vertigo is one thing. What are the differences there? Go ahead.
So
let's get a little nerdy.
Yeah, so vertigo can either come from an inner ear issue like we touched on, or from the central nervous system.
Okay, so it could be a neurological condition, it could be a disease causing it, but it could just be something wrong with the ear. Okay, but they're still sometimes treatable.
Oh yeah.
Okay, so how do we treat them after you diagnose where the problem's coming from? How do you treat it?
So for an inner ear problem, that's going to be kind of a positional treatment. And then for a central nervous problem, that's going to be challenging the VOR system, some habituation exercises.
Habituation, getting used to something.
Correct.
Okay, what would those look like?
So it's a lot of turning of the head, focusing on something, it makes you dizzy in the process, but it's getting used to it.
Okay, now if I remember, I'm going back a few years to high school, a psych year. Habituation is if you live in a house that has sounds like a grandfather clock or birds or something, you will tend to not hear those anymore. Your brain kind of shuts it out. And that's kind of what you're doing. You're training it to ignore the bad stimulus. Is that right?
Correct, yeah.
Really? Is that it?
Yeah, it's similar.
So what is this big device over here then? What do we use that for?
So that is an anti-gravity treadmill called the Ultra G. We use it for a number of different things. I have patients that are spinal cord injuries. I also have patients that have arthritis. So it kind of mimics a pull therapy.
I got to try this, right? I got to. Okay, so let's give it a shot. Now we can't really do this because it's super noisy, but I would start by wearing this scuba outfit here.
Yeah, it's kind of like the Jetson pants, I feel like.
It is. It looks like a witch's hat for Siamese twins.
Yeah.
But it's this would put on like a girdle, like a skirt then,
Correct,
right?
Yeah.
Okay, now talk me through this.
And then you would just step on that square.
Okay.
Step into the circle for
Into the circle. Of course, I would be wearing the trousers at this point. Okay.
And then we'd bring it up to where it clicks.
This is super cool. So I feel like I'm being surrounded. So then I would be zipped in here.
Yes.
Okay, then what happens?
So basically we just turn on the machine, we allow it to calibrate, it would just blow up with air.
Like the character from Willy Wonka, who was that?
Violet Beauregard.
Right,
Yeah.
you get all okay, so keep going.
And so from there, we can change all the different things. We can change the incline. We can change the amount of weight. We can put you to actually down to 20% of your body weight.
Really?
Yeah.
So let's just, for numbers, let's say that I weigh 200 pounds. So 20% would be 40 pounds. You can make it feel like I only weigh 40 pounds.
Yeah, and it's pretty difficult to walk in whenever you feel like,
This would be, so, because the moon is like 1/6. You can make it feel like you're walking on the moon.
Oh, yeah, or even further down, less gravity than the moon.
So what this does is it gets people the ability to kind of ease into it then. So instead of dealing with their entire body, we used to a percentage. So it's like working out in the gym. You just increase the weight.
Correct, yeah. And then we can also work in balance in here because it provides a safe environment that you can kind of go into one leg, one foot, kind of a single leg balance. Yeah, there you go.
And if you start to lose your balance,
you're there. Yeah,
there.
It's catching you. And don't forget, you're strapped into here too.
That is fantastic.
Whenever you're 20% of your body weight, you can literally sit down into it, and it holds you up.
Okay, so it's like the water thing, but it's not as messy.
Cleaner, But you don't have to dry off.
Maybe more noisy, but it's so. What are some reasonable expectations that people can have when they come for treatment for balance? What's something they can really kind of look forward to?
For balance, we're really looking at improving your mobility, improving strength, improving stability. Whenever someone has decreased balance or impaired balance, the biggest issue is the fear of falling.
Yeah.
And so that's one of the greatest things I love to treat, is to really provide that population with confidence in order to go home, be more independent, go out into the community to do more and really, really feel confident in what they're doing.
So because there are unintended consequences of these things. For instance, like we learned during the pandemic, not only did we need to be afraid of the illness itself, but we also needed to be afraid of the things that the shutdowns and the isolation lead to, which we learned later. So just people can think, well, balance, you want to fix that because they will hurt themselves. But that would also cause someone to say, I'm afraid to go out to the movies, to go shopping, because what if I hurt myself? What if I embarrass myself?
Right.
And then that creates more problems because they're not as mobile. So it becomes a snowball effect.
Right, yeah, and leads to muscle atrophy, wasting.
And loss of confidence.
Yeah.
Which is real as well.
Right.
Okay, so if somebody wants to be treated for balance issues, how do they start here?
So it's really easy. You can just give us a call. Our office staff is great at getting people into the door. And then from there, you would see me or the other therapist, Lauren, for an initial eval.
And it's just that easy.
Yeah.
How long does it typically take? Well, treatments take.
It does depend. With vertigo, it could be a fast turnover. For more of like the mechanical issues, we typically, a couple weeks. And of course, sometimes longer, but we're here every step of the way.
All right. Excellent. Well, thank you very much. So please see Lauren or Emily at MAXX Physical Therapy. Thank you for joining us for this episode of Doctor on Demand.
Thank you for having me.